So we're starting with the sealant setup. Your patient would be given protective eyewear to put on. I'm going to put it on the tray. We would also put a bib around the patient's neck to protect their clothing from any splatter of anything that we're working with, right? Whether it be material that we're using as the sealant, or water from the air water syringe, or saliva, right? So we want to protect the clothing with this napkin. Then, guess what this is? This is the high-speed handpiece. Remember we spoke about it? It's in this special pouch because it's been sterilized. Let me tell you how I know it's been sterilized. Can you see that gray button right there? Right there. That color indicates to me that it's been through the sterilizer, because an unsterilized pouch has a pink button. So when that pink dab changes to gray, I know my instrument is sterilized. So that's a handpiece. We're going to use a curing light. So this is the light that gives us the power to turn the soft sealant into a hard material. Okay, we're on a roll. And we have a basic setup here. Let me show you what's in the basic setup. The basic setup has three things that are basic to just about any procedure that the doctor is doing. That would be the mirror, the mouth mirror in particular. That would be the explorer. It has two ends. One is curved and the other one is straight. Now, sometimes these explorers have different ends that have different uses, but I'm not going to get into that. The explorer helps us to determine if there are any soft spots on the tooth, to determine if the filling or the sealant is hard. The explorer, to explore. And then finally, we have what we call cotton pliers or pickups. So the cotton pliers, the mouth mirror, and the explorer together are called the basic. And that basic setup is there for most of the procedures. So we're talking about setting up for the sealant. We've spoken about the protective eyewear for the patient. We've spoken about the patient bib that goes around the neck. We've spoken about the high-speed handpiece. And you know from another challenge day what this looks like and what it does. We've spoken about the curing light. And now we're speaking about the slow speed handpiece. And then we're speaking about the etchant and the sealant material and the saliva ejector and the air water syringe tip. And we showed you where that goes before, right? See how we're building one thing helps with the other? And here is our burr, because some dentists prepare the tooth a little bit, just roughen it up before they flow the sealant in. But you remember it's a preventative procedure when we place a sealant. So we're not doing a lot of tooth removal. And then, remember this trophy cup? Where does it fit? On top of the slow speed piece. Okay? And then we have some cotton rolls. Wow, what a lot for just one setup. Let's review it again. The protective eyewear for the patient. The bib to go around their neck. the high-speed handpiece, the curing light, the basic setup, the etchant, the sealant, the saliva ejector, the Profi angle, and this tip goes on the air-water syringe. We have some cotton rolls, and I have a little cutting instrument, a little burr, that sometimes is used to roughen up the surface of the tooth before the sealant is placed. So, there you have it, the setup for the sealant. So, the first thing that the doctor will do is check the tooth using the two instruments, the mirror and the explorer. Then they will roughen up the tooth surface with the high-speed handpiece. And of course, a burr is the cutting tip that would be inside the high-speed handpiece. And then we're going to use something to clean off that tooth really well. So the slow-speed handpiece with this Profi tip will be used to scoop out some of this to clean the tooth surface off really, really well. Once we've done that, we're going to apply a mild acid known as the etchant. Then we use the air-water syringe and the tip to rinse it off. And then once we've done that, it's dried very well with the same air-water syringe. And then the sealant material is applied and we cure it with the curing light. There you go. So that is the setup for the dental sealant.